Hello, this is Chris Westfall with a brief update about Manhattan Life. You know, in last week's webinar, we talked about Manhattan Life at length. We went through the underwriting guide. We talked about the electronic application and where they're positioned in the market and some of the strongest states in which you need to utilize them if you're selling in those states. So make sure you check out the webinar from the last week of September. On that Friday webinar, we went in depth into Manhattan Life. But a couple of key points I want to bring to your attention. As you can see by this color-coded health question list, which we also have available under the Medicare Supplement tab at MedicareAgentTraining.com. MedicareAgentTraining.com. We've got all the health questions for all the companies you could potentially think of writing so that you can do like I do and have them actually on your desk so you can pull them out and see if the person qualifies when you see that they're a really good candidate for those rates. I want to bring to your attention a couple of things that stand out on the underwriting with Manhattan Life that you may not otherwise, unless you've studied it yet, may not be aware of, and you need to before you pull this out. As you're listening to somebody's general health, you ask them generally how healthy they are, and before you get into specifics, if you hear these keywords, you'll know to bypass Manhattan Life because they're not the one for that person. Now, every time we have underwriting questions from a company, it usually gives us a clear indicator as to where they'll be years down the road. It doesn't always translate this way, but the good rule of thumb is the tougher it is to get in, the better it's going to be long term, because they can better keep a handle on who's coming in and thus manage their health of the group much better. So it's not so bad that these are a lot tighter with Manhattan Life. Their rates are really aggressive, and we're hoping with the combination of the two, we'll be able to keep the rates down, keep happy people for the entire duration of our lifetime with that client. So I want to point out a couple of things that don't exist commonly in other underwriting scenarios with other companies. Now, the first one that comes to mind that I see here is Parkinson's disease. Well, that's not it. It's the highlighted part. Bipolar disorder, not usually singled out. Manic depression, which is bipolar disorder, it's just a different word. And then down here, instead of just chronic kidney disease, they also added the word or kidney insufficiency. Now, I did have a client a few years ago had some kidney insufficiency issues, but it was not categorized as kidney disease. So you need to listen for that if they talk about any kidney problems. And under the emphysema, COPD, which is typical, they've added sleep apnea. So if you have somebody that has to use a CPAP machine, or they're using the other one, not CPAP, whatever the mask things are, there's two different kinds. Now, sleep apnea is a condition that they will underwrite against at Manhattan Life. Then skip down to question number 10 on the generic application. Are you currently using the services of a home health care agency? So if somebody's coming in to help cook and clean in their home health care agency, that in and itself is a trigger. And one other thing down here, rheumatoid arthritis. Most companies do have that. Just want to point out that they do as well. This is the most unique one, though. Question 15. Have you had a surgical procedure performed in the last 6 months? And then it leaves it open to the scrutiny of an underwriter to decide whether or not that condition is going to need follow-up care, if it's going to be a long-term recovery where they're going to have to intervene and supplement that recovery process. If somebody had, which is typical, you'll have a knee replacement or hip replacement, which will have ongoing care and rehabilitation and treatment and so forth. So this just talks about any surgical procedure performed, and they actually want you to write that in where the health questions are. That's very unique. Another thing about Manhattan Life, they do two extra things that some other companies don't do. One, they ask for every prescription. You have to list that. Most do, but they also ask for the primary physician's name, address, telephone number, date of last visit, and reason of last visit. Now remember, Manhattan Life is a B+ rated company, been around for a long time, part of the Family Life and that group of companies. It's all under the Manhattan Life group. But the rates are fantastic, and you'll see that their spouse discount is second to none. If you're living with anybody in the same household that's 60 or over, whether or not they get a policy, whether or not they even have Medicare, if they're living in the house, whether they're a spouse or not, you still get that spouse discount rate, which is really phenomenal. So that's just about it. Oh, and one other thing, we'll go back to question 1. Have you suffered 2 or more falls within a 6-month period? 2 or more falls. So that's kind of interesting slant on things, kind of a modern, up-to-date underwriting criteria, but it is so different than the field that I thought I'd bring it to your attention before you just throw Manhattan Life into the mix, see a wonderful rate, and present that to your client. Again, for a more in-depth review the webinar that we did last week of September 2013, which was September 27th. We went in-depth into Manhattan Life. The contracting is available on sellmedicarebyphone.com, and if I can help you in any way, send a support ticket over at medicareagenttraining.com. Thanks for being a member, and have a great day. Bye-bye.